Welcome back, everybody. 5:20. What do you do if your child can't or won't go to sleep? Or maybe falls asleep only to be wide awake in the middle of the night? According to the National Sleep Foundation, 70% of kids under 10 experience some kind of sleep trouble. 80% of kids, listen to this, 11 to 17, do not get enough sleep. So as a result, a handful of companies are marketing sleep meds for children. There you go, right there. A chill pill, just like mom and dad use, right? There's the controversy. Are parents dosing little Donnie just so they can relax? And what do these pills do to brains that are still forming? Dr. Rosen Crosby from Lapeer Pediatrics in Beverly Hills is here to give us a little direction and kind of cut through the marketing a little bit. First of all, you saw the ingredients there on these meds. Chamomile tea, you can't.
It's fine.
That's fine.
I have no problem with that.
Melatonin, they sell that in drugstores and grocery stores. What's wrong with that?
I have a problem with that.
Why? Why?
Well, first of all, I think a lot of people don't realize that it's a hormone.
Right.
So I don't think that if they realize they're giving their child a hormone that our brain naturally produces to regulate our sleep-wake cycle, you want to give them a hormone. I just don't think, first of all, that that's a good idea. Second of all, what hormone can you get at a drugstore and a health food store without a prescription? It just seems completely wrong.
Well, that's a bigger question.
Right? I mean, it's not right. I mean, it's not like you're just going to have some tea to go to sleep. I mean, this is something that is a chemical in your brain, and we don't know if you give this to children what it's going to do to them, even developmentally. This is a developing brain. You know, hormones are very fine-tuned in our bodies and do very specific tasks.
Okay, the doctor who developed this is a pediatrician as well, and these are Zarbee's, and we'll say a couple things about that.
Sure.
But he says it's better than what parents are doing, which is giving their kids Benadryl. He seems to think that that this is safer than Benadryl.
But I mean, I think it's always how long you're using it and when you're using it. I don't have a problem with using this if you're going on a flight to London. So
Okay.
a one-time here and there, I think it's fine. I think that there are kids who have problems where they do need some melatonin. They're neurodevelopmentally maybe delayed or have some impairment, and they have or ADHD or other issues where they require special help. And still, we want to try everything else first before we go to a hormone treatment.
A hormone treatment, you're saying? Wow.
It's a hormone.
Is
I
it
mean, our
potentially-
brains already have it, and kids may even have more already than adults do. And I don't know what it's going to do to them. A lot of the studies were done on kids who are already neurodevelopmentally impaired or had ADHD. And so a lot of tests, well, it's pretty safe, or as the FDA calls it, GRAS, generally regarded as safe. But they're not regulating it.
Okay, let's split two things now. You've talked about the medical necessity. Some kids, there's a medical necessity. You say go see a psychiatrist, a pediatrician,
A neurologist.
First.
Yes.
But then there's the parent factor. How often do you think this is mom just wanting to sit down with that glass of Chardonnay and watch her best TV show?
Well, I read about that, and I read online about someone who admitted to the pediatrician that she has a lot of children, and to get them all in bed at night is really tough. So she lines up all 5 kids and, brushes teeth, gives them the melatonin, and in 20 minutes they're all asleep. I'm horrified.
You're horrified by that?
Yes, I'm horrified by that. How about before anyone knew about melatonin, what did people do? Well, you have a good bedtime routine.
In fact, we have some advice from you that I want to put up on the screen, because that's really where it should start.
Yes, good sleep hygiene.
Pills are no substitute for good parenting. So you say seek advice from family and friends. What does that mean?
Well, I think, that one is more just everyone, maybe what do you think I should do? Like maybe you don't realize that you're keeping them up too late, or, they're not getting, or having too much like a dessert right before bedtime, or sugar, so sometimes you can get some good feedback.
Okay, find out if your child is nervous. Now, this is also controversial. We don't have time for this, but you say make a bed on the floor and
well,
next
there's
to
a lot
yours.
of other issues. Sleep is a huge topic. So some kids do have anxiety. I know kids who have severe anxiety, and that's a whole other issue than your general standard kid who just doesn't want to go to bed. And I think that's more what we're talking about tonight. But there are methods for that too, and it is a bigger deal.
All right.
But you want it. Screen time is a big problem. So
and that's would you say screen?
Screen time. So any screen. So whether they're playing with their iPad, iPod, TV, computer, and inside here they give tips.
And their tips are actually good.
The tips are good.
The tips are good.
I just not into what's in the bottle, but the tips are good in the box.
All right, so Zarbi, you can sell the tips, but not the melatonin, according to Dr. Crosby.
No, you want to make sure your kids get a lot of exercise during the day and get rid of that nervous and extra energy too.
Right.
Tire them out. Have a set routine. Everyone needs to be structured. It has to be organized.
Okay.
None of these chaotic nights.
All right.
All
right. Dr. Rosen Crosby from Lapeer Pediatrics. Thanks very much for hashing it out for us, Christine.